What causes urinary incontinence? That's the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine. So stay tuned. Alright, so you want to know what causes incontinence. There's so many things that can cause incontinence. So it doesn't necessarily all have to be childbirth. It doesn't have to be that you're a woman past a certain age. It doesn't have to do with the fact that you're obese or you may be a smoker. Not necessarily all of that. If you think about incontinence, which by the way, there's more than urinary incontinence, but we're going to talk about urinary incontinence in this video. If you think about it, anything that has to do with the flow of urine. So it can be a nerve that is in charge of your bladder control, the nerve that are in charge of the musculature that let go of the area so you can urinate. We're talking about pelvic floor muscles. It can be the nerve that innervates those, not necessarily the weakness because it went through the trauma of childbirth, as an example. It can be because of the way the pelvis itself is positioned. So if you think about it, can you see me okay here? If your pelvis, the floor of your pelvis and the alignment of your pelvis in a neutral position, it's not tilting, as an example, then the organs, your bladder, your uterus, everything else within the pelvic inlet where the pelvis is not tilted forward to impose extra weight on the area, making it more difficult to hold the urine. It could be the prostate, so it doesn't have to be a female. It could be an enlarged prostate, the internal organs, just the weight of the internal organs and the positioning of them as a result of your pelvis tilting in one direction versus the other being neutral instead. Or in order to be neutral, you're in one way or another, tilted forward or backward. Whatever the case may be, those are all the parts of your incontinence, causing incontinence, that are totally being disregarded. So typically when it comes to incontinence, either we say, oh, well, I just gave birth and that's the case, which is not the case. There are plenty of women who go through childbirth without having any issues with incontinence. And then there are people who, you may have that, and then not realize that there's an underlying problem with the nerves going to the areas that are in charge of you being able to hold your urine. Or it could simply be the alignment of your pelvis, your lower back, your hips, the weakness of your lower ab not working with your lower back, therefore leading to that tilting of your pelvis, as an example. Over time, the problem becomes more chronic, the issue becomes more intense in the weakness, and we're doing nothing about it. We're thinking that's part of aging, and the answer is no. If you ignore the problem, by the time you're older, it becomes more of an ingrained problem. So it's much harder to take care of it. It is not okay even if you got pregnant or you had babies, vaginal birth, or even C-section. I've done a video on hysterectomy and incontinence. So we're going to make sure that we put that in this video. You have to understand that causes of urinary incontinence is more than just the weakness of the pelvic floor. So then the solution, what is the solution? Number one is to find out what the weakness is. I'm seeing more and more pelvic floor dysfunction with or without incontinence in much younger people because our lifestyle is so compromised. We have sedentary lifestyle, weakened muscles, not just the pelvic floor. So there are things that you can do, and going in with a physical therapist that's trained in pelvic floor muscles you basically have done a video on that. We're going to make sure we put that one on pelvic floor dysfunction and physical therapy here at the end of this video. But you have to understand there's a value in that, but that is not going to serve you long term. So we need to first understand the type of incontinence you have, and then see what needs to be done about it. What else is feeding that problem? So we need to not only address the cause, but address the feeders of the cause, or the problem will return. And there is a machine called emsella that we have, and we don't necessarily only deal with people with incontinence, but when incontinence is along with other things, that's what we take care of in the clinic. And we have this machine because it provides 400 kegels a minute. That's more than 1 kegel a second. Over a course of 28 minutes is 11,200 kegels, which you can't beat. But the purpose of that is to strengthen the pelvic floor muscles as we're addressing all the other things. By the way, not every incontinence has that as a solution. You need to understand there is hyperactive incontinence where that's actually going to make it worse. So just wanted to throw that in there. You need to understand the cause of your incontinence. The cause of your incontinence is not childbirth. That may be the straw that broke the camel's back. It's not to put stuff inside of you and try to squeeze it. That's not enough. It's not to just go in and relax those muscles. We need to make sure we're not giving the body any other reasons for those muscles to contract or let go like they do. It needs to be over a course of time and needs to require maintenance done by you on a daily basis. So don't just put yourself at the mercy of what's out there. Try to go with what makes sense, logically speaking, and then pursue it. Educate yourself. Make sure you subscribe to my channel. This channel is fully dedicated to core and pelvic floor dysfunction. Thanks for watching. Take care.